COVID-19 has shattered a daily record, infecting more Americans every day than it has at the time the pandemic actually began. On Friday, the country set a record for new coronavirus cases. We're talking 193,000 within 24 hours. In that same time period, 1,000 Americans have died from COVID-19. The CDC is now warning that daily number of virus-related deaths could double by December 5th. Meanwhile, hospitals and healthcare workers are hitting breaking points once again.
Our healthcare heroes have fought valiantly day after day, but we have no reserves.
So at this point, multiple states are now imposing new restrictions to slow the virus's spread. New Mexico and Oregon, they ordered all non-essential businesses to shut down for 2 weeks. California and Washington issued an advisory discouraging non-essential travel and urging anyone coming into quarantine. And in New York City, restaurants and bars are now under a 10 p.m. curfew. The mayor there warning schools could actually close as soon as Monday. And more than 1 million Texans have tested positive for COVID-19 since March, according to the Texas Department of State Health Services. That's nearly the population of Collin County, and we are the first state to surpass 1 million cases. And if Texas was a country instead of a state, it would rank in the top 10 nations with the most overall coronavirus cases. That's according to data from Johns Hopkins University. Now, look at the trend in Dallas County here. It's averaged 1,000 cases a day over the past 7 days. Yesterday, the cases dipped a little bit here. The county reported 767 cases, but that trend line is still going up. Now, there's growing concern in Tarrant County as well. This is a look at the cases in the county since March 11th. We saw a big drop in cases in September. This week, for the third day, the county has reported more than 1,000 cases. Yesterday, the county reported 1,400 cases. But there is new hope in this fight here. Jobin Paniker reports on new COVID-19 therapies that will be available here in Texas starting next week.
There are rarely silver bullets in medicine. Hundreds test positive daily, and thousands have already died from COVID-19. Starting next week, Governor Greg Abbott says the state will receive large shipments of 2 antibody therapies. The first is called bamlanivimab. The second is Regeneron, the same therapy given to President Trump.
I'm just grateful that the day has arrived.
Congressman Michael Burgess represents District 26, Denton, Dallas, and Tarrant counties. He's also a medical doctor.
In 10 and a half months' time, we've gone from just knowing about this virus to now having not 1 but 2 therapeutics. Is a phenomenal rate of speed to develop these types of interventions.
The therapy doses were given to Texas by the U.S. Department of Health and Human Services at no cost.
The first stages of this will be for frontline healthcare workers and those most likely to be challenged with losing their life because of COVID.
Ryan Mulcahy was one of those frontline workers. The 42-year-old died after a long fight with the virus.
He was just supposed to get over it and keep going. I mean, nothing could have been more unexpected.
The hope is these therapies prevent hospitalizations, which have gone up dramatically lately. Some states have already re-upped orders, which begs the question, are more shutdowns in our future? Congressman Burgess says shutdowns are not the answer.
We know so much more about this illness now. It's a different situation in the fall than it was in the spring.
With therapies on the way and a possible vaccine on the horizon, it still does not excuse us from our personal responsibilities against this virus. Masks, social distance, and wash those hands. In Dallas, I'm Jobin Paniker.
Well, President Trump says a free vaccine will be available by April and another will be ready for high-risk patients sometime next month. The president also promised that his administration will not impose a national lockdown.